Sustainable Health Profit CNBC Indonesia bersama saya Shafinaz Nachiar, dan saat ini saya sudah bersama dengan President Director AstraZeneca Indonesia, Mrs. Esra Erkomay. Hi Mrs., thank you so much for coming to CNBC Indonesia.
Hello Shafi, thanks for inviting me.
Yes. We know that AstraZeneca is very well known as a vaccine company, but what is it actually about?
So AstraZeneca is a science-led biopharmaceutical company operating in Indonesia more than 54 years. Actually, we are beyond a vaccine company. We are mainly operating in 4 therapy areas: oncology, cardiovascular, renal and metabolism, respiratory and immunology, and we recently also entered to the rare disease space. And across that 54 years, we have delivered more than 60 innovative medicines to Indonesia. And one other thing, beyond being a healthcare company, we also try to operate in a sustainable way. We believe the interconnectivity between the healthy people, healthy society, and healthy planet. So we are also taking serious initiatives to make sure that we eliminate the carbon emissions, become zero carbon this year, and also hopefully carbon negative by 2030.
Okay, so it's not only about vaccine, but also you are focused on therapeutic as well.
Definitely from oncology to respiratory to heart disease, and our also therapy areas is very much aligned what are the needs of the Indonesian government as a healthcare priority, which is our also main focus.
And can you explain about how has the company contributed in supporting Indonesian healthcare by far?
Sure. So one of the areas that we focus on, as I mentioned, cancer disease and also respiratory diseases, which two are the major healthcare problems in Indonesia. Particularly in respiratory diseases, for example, asthma and COPD, and also in oncology, diseases like lung cancer, breast cancer, and gastrointestinal cancers contribute significantly to the healthcare burden. So we try to contribute beyond our medicines, how we can deliver as a healthcare ecosystem partner, finding solutions from the disease awareness to early screening, diagnosis, diagnostic, through the treatment and follow-up, to make sure that we contribute to the healthcare environment, ecosystem from end to end. Just to give some couple of initiatives we do, for example, in the primary healthcare, right? We believe primary healthcare is also play a crucial role. How we can ensure the GPs are well educated on those, some of the common diseases like asthma, COPD, which is also linked to the air pollution. Smoking, which is prominent also in Indonesia. We are contributing significantly to the GP education through the non-communicable diseases. And also we try to partner with the digital partners who can contribute, how to find solution in the early detection from the AI, etc., to make sure that we find those patients early, we treat them early, and we contribute to the society and also economy in the long run.
Okay, how do you see so far with all the therapy, with all the vaccine that you have, with all the program that the company has? How do you see the public here?
So I think we are contributing significantly well. One area in Indonesian government to make sure that we deliver the innovative treatments here in Indonesia as fast as possible. So as AstraZeneca Indonesia, we are committed to deliver, register, and make sure all those innovative medicines are available in Indonesia rather than outside. That's our #1 priority. Secondly, as I mentioned, to contribute to the healthcare, we are trying to contribute to the infrastructure end-to-end, healthcare, educating the healthcare professionals, how we can increase the capability and capacity in the diagnostics, and also through the treatment. So that's what we try to do across Indonesia, along with the other countries we operate.
And what kind of strategic role does your company in support Indonesia effort to reduce mortality rate in regards of cancer and chronic respiratory diseases?
So, for example, in cancer, it is very important you detect cancer early to make sure that you find out early. You find out what are the tumor drivers of the cancer, because cancer space is moving towards more targeted therapies rather than fits all. But what are the tumor drivers that causes the tumor grow in the body, so that we can target particular areas and then we find them early so that we save lives. So that's what we try to focus. Just give one example. Through the also medical associations, we try to come up some screening tools like NARU, right, in the primary healthcare, who are the high-risk patients for the lung disease, so that we find them early and then treat them early and then save lives. Secondly, I think in the as I mentioned, in the asthma and COPD space, which is also a big burden, we try to make sure that GPs are capable treating, diagnosing asthma, COPD, how we can make sure they also use the treatments according to the scientific guidelines, align with the international guidelines, local guidelines, associations, to make sure that they deliver the best care to their patients for better outcomes.
And how is AstraZeneca collaborating with National Stakeholder? Can you explain and mention about the collaboration between you and the Ministry of Health, the BPJS Kesehatan, or maybe all the hospitals that we have here?
Sure. I think we are working with the government in multiple ways. As I mentioned, one side is on how we can bring the novel medications here in Indonesia. We're working hand in hand, accelerating the regulatory first to our innovative medicines here in Indonesia. That's one aspect. Another aspect is that we would like to ensure that through the health technology assessment, cost effectiveness studies we make locally in Indonesia, we try to make sure that our medicines that we would like to access to the broader population is cost effective, deliver best outcomes versus the conditional therapies available, and make sure the cost effectively delivering these outcomes within the Indonesian setting. So we are working hand in hand with the universities, associations, to make sure that we delivered all those medications in line with the local Indonesian regulations and also necessities that we need to provide. Also, as I mentioned, we are not only here to make sure that access to the broader patients, how we can be partner of choice in streamlining the patient journey to make sure that patients get the right diagnosis, right treatment as early as possible to deliver the best outcomes.